Let me now ask Mary Beth Shannon if you can provide your comments.
Thank you, Chairman Stone and Chairman Lee and committee members for taking on this really important issue. I'm Mary Beth Shannon with the California Healthcare Foundation. The foundation has a mission to improve quality and access to health care in the state, and as part of that, we sponsor a website called calqualitycare.org, and that website covers information on lots of different provider types, including hospitals, medical groups, as well as long-term care providers like nursing homes and home health and hospice services. With the rapid growth of assisted living facilities, or RCFEs, we also added pages for that, with that information, but unfortunately, it's just a handful of measures that we're able to report because so little is collected. I actually have some examples of reports, if the sergeant can pass these out, to give you a sense of how much information is available on nursing homes versus how much is available on assisted living facilities. So I'll move on and come back to those reports in a second. As others have explained today, there's been a rapid growth in these kinds of facilities and people using these as ways to take care of elder family members. And many family members view residential care facilities as an alternative to nursing home care, and many assisted living facilities market themselves as being available to provide services to seniors that are in declining health. So what's really important, I think, is for family members to understand more about these facilities when they make a selection, and the lack of information available to people easily to find out which facilities are good and which facilities are not good is very difficult. So the reports the sergeant's handing out, the first one that's labeled A is an example of what information we can provide on nursing homes. It's huge, extensive. I think it goes 18 pages. In contrast, the information that's available on assisted living facility fits on about 1 page. It's a handful of measures that are primarily limited to ownership information and phone numbers and number of the beds, very, very basic. So as my colleagues here have mentioned, the current inspections are only every 5 years with some level of random inspections supplementing that. But I wanted to talk a little bit about how these inspections work and how the field analysts perform their job. So they actually go out into the field and use what was a state-of-the-art program in 1990 when it was released, which is a Lotus Notes program, to collect the information and inspections. But today, I mean, the Lotus Notes program is primarily a document storage and email system. It doesn't really feed a modern database. And so after these inspections are done, the reports are essentially printed on paper and filed away in boxes in the district offices. So if you're a family member in search of information about an RCFE, the first thing you have to do is actually find the district office that would contain these records. You have to call in advance and let them know which facilities you'd like to review files on. They will then take some time to locate those files and redact any confidential information that might be in there. So a family member would be asked to make an appointment some weeks in the future to actually come and actually look at the files. And then when you arrive to look at the files, you're given a proctor or a department member who can be available to you to answer questions, but very few family members are going to undertake that kind of process. Often you're looking at a facility in a different geographic area than you live, so getting to a district office, waiting 2 weeks to get the file, and actually then going through the file is, I think, extremely onerous. So few people actually take these steps. To save you the trip to district office, I also included a copy of an inspection report just so you have a sense of what they look like. That's in the material that the sergeant just distributed. So in an effort to correct this problem, the California Healthcare Foundation had a number of conversations with the Department of Social Services about how we might be able to increase the amount of information that's available. So these conversations started in 2008. In 2009, we actually funded a project to help the department create a standardized coding language so that what information was being collected in the field could eventually be translated into what was a planned new licensing information system. My understanding at the time that we funded this project was that the licensing information system was indeed funded and would be developed, but the project was successful. The new coding system was developed. The field analysts were trained to use it, but the licensing inspection system was never built. My understanding is it wasn't built because it was determined to be unworkable to link a new system to the Lotus Notes system, which really couldn't provide information in a format that would be usable. So that project stalled, and we're basically now continuing at a standstill where people have to access paper records and don't have much information available online. I think this is a particular problem because given the change in inspection frequency, we've really moved to kind of a complaint-based oversight system. And with a system like that, I think it's really important to have an early warning system in place where you can identify facilities that are in danger of becoming problematic, or you can look at problem facilities with common ownership. And in the absence of an information system, not only do consumers have difficulty finding out about the quality of care that's being provided, the department itself has a lot of difficulty looking across the state and picking up systematic errors. So I think this is a critically important component of fixing the problem, is being able to get more information and have that more easily accessible to people. So I would be happy to answer questions.
All right, do you have any questions? Someone Stone?
So what do you see as barriers, and real or perceived barriers, to really implementing information systems?
So we do have 450 or so analysts out in the field. The actual hardware that they use would probably need to be replaced. I think the benefit is that we have advanced technology significantly since 1990 when the system was put in place. And so you could probably use laptops or other kind of lower cost technology to actually collect the information in the field and store it in a way that could easily be transferred into a modern information system that could be used to not only provide reports for the department, but also provide reports to those of us out in the field trying to make information available to consumers.
If I want to book a hotel online, I can get a lot more information instantly, and I think that's what people are used to seeing. This is a critical decision that people are making for their loved ones. And so that transition seems to me to make a lot of sense and would also provide that early warning to the department, I would think, about where issues are starting to develop. And with some of the predictive tools that are out there, I think we could learn a lot by having that information.
Yes, I mean, it is 2014. It's kind of amazing that we don't have this kind of information available for these really long-term important decisions for family members to make.
And what about the state of the information that's there now? You gave us the sort of the handwritten stuff. In your view, is this translatable to an electronic system, or does it even matter?
Well, what we did in the project that we completed in 2009 was to actually at least have the citations consistently coded and the language be understandable. Prior to that, field analysts really kind of wrote what they believed. It wasn't in any kind of consistent format, which made it extremely difficult to move to an information system. So I think the information is now being collected. There's consistent codes and consistent language being used. So it's a great step toward moving to an information system, but we still, I think, are going to have to move beyond this Lotus Notes program to something that can actually be integrated with a modern online database.
Yeah, I don't think I've heard Lotus Notes in quite
a long time. It's actually IBM Notes now. It's been purchased, but still the program hasn't been updated significantly.
Yeah, thank you.
Assemblyman Cabral.
Thank you, Mr. Chair, and thank you. I'll tell you all day long about technology and how as a government, we completely underutilize our ability to implement technology to make things better, to make government better, to make government more efficient. I chair a committee that specifically deals with this issue of technology. But one of the things that I still keep coming back to is this issue of inspections. And if we have this information online where people can go and look at it, if you have nobody going there for 5 years, you could be looking at information that's 4 years old. And what value is that information, especially considering that there could be other issues and there could have not been any corrective action because there just isn't enough people going into the facilities frequently enough to give us an accurate picture of what we're dealing with, and so that parents or family members really know what they're going to be putting their loved ones into. So I appreciate and I agree with you, but I think also we need more continuity in terms of information gathered and having real-time information online. But I do agree that we need it.
Yeah.
If I can follow up on some points that Assemblymember Stone raised. So clearly, the way in which you somehow see this system working, so that it's transparent, it's open to consumer, easily available, is that you've got the coding system, and now you just have to deal with the hardware problem, right?
Well, yeah, I think we have a hardware problem in the field. The field analysts probably need replacement equipment, as well as then the central information system that the department would use to manage and track trends and be able to identify, systematic errors that they would be able to then focus a little bit more of their complaint-based system on. So I think you really do need both of software and hardware solutions.
And absent the hardware solution, are you suggesting that we will not probably be able to get any of this in an easily accessible fashion?
My understanding of the review that was done by the state, the reason the licensing information system was never constructed was that the field system was not sufficient to be able to feed the information system, so that would require both systems be replaced. But the department could probably be more coherent on that answer.
Okay. And you've studied this issue quite extensively. You've kind of done some work. Looking at, other jurisdictions, maybe other states and so on, how do they handle this particular issue, this particular problem? Can you talk a little bit about that?
Yes, we've been concerned about this issue for some time. We actually commissioned some work to be done by the National Senior Citizen Law Center, and Eric Carlson, an attorney with that group, is speaking on a later panel. And he actually did look at other states, and what they've done, and really what the best practices are. And California is very far behind, particularly in terms of the amount of information that's being made available to the public.
And given the difficulty of getting a lot of this information online and easily accessible, have you had discussions with the department as what seems to be the problem, as to why they can't somehow either move on the hardware issue or finding an alternative if, in fact, the hardware problem can't be solved, that there's other ways of somehow getting this information, online?
Yes, so we have had conversations with the current management of the department, and they are interested in solving this problem. There is a budgetary constraint, I think, that they're working with, which is making it difficult to solve it. But they are interested in looking at solutions. One of the things we talked about doing was piloting a project where we actually take the paper files in a district office and digitize those so that you could pull off key pieces of information, the last inspection, the particular citations that may have been violated, any complaints, and track that. And we think you could pull that off by digitizing the paper files. That doesn't solve the problem going forward, though. We're still creating more paper that would have to be digitized. So I think we need both a long-term solution and a solution for going back and picking up the historical information from the paper. But again, there are technology solutions now to deal with these issues, and the sooner we start on them, I think the better.
Well, it seems to me that, like, let's say a short term, clearly you may not have a system that is fully integrated across counties, across maybe even the, region areas and so on. But it seems to me that if we're looking at just one regional office, that whatever the data and analysts may find for a particular day somehow gets entered into some kind of a database that's easily accessible just within that jurisdiction. That's all I'm talking about. I'm not talking about anything fancy than that, that residents from a particular county can then at least access county information or regional information of that particular office, of that particular office, and looking then at the performance of some of these assisted living facilities as to, what are the violations and even what are the blemishes and so on.
At a minimum, I think that would be a solution to look at an individual district office, but I guess I would prefer to have the district offices consistently collect that information so that it could be aggregated. One of the problems of ownership, where you have an owner with facilities based in different locations across the state, and one of the difficulties has been it's hard for the department to understand that there may be complaints occurring in all of those facilities and that there is a link of common ownership because each is housed in an individual district office, and where the district office staff may be aware of the problem, they're not aware of a similar problem occurring in another region of the state. So I think if each office did that consistently and we could aggregate it, it would be even more helpful.
Okay. All right. All right. Thank you very, very much.